no fever and no pain. Monday night, August 1st, the same thing, no fever. Tuesday morning, he was fine. I just really thought that he had a gas pain or maybe he needed to try to go to the bathroom. The nurse told me that that could have been his first symptom. So with that being said, and thinking that if this was a normal school week and a normal school day at my house, with my son having a slight stomach ache on Sunday evening, he woke up fine Monday morning without a fever, and I would have sent him to school as normal, and I would not have thought anything was wrong. He did not have any other signs from that Sunday night until Saturday, August 8th, which was 7 days later, and he developed a fever. I would feel horrible, and so would my husband, if I had sent our son to school and he gave this to all of his classmates. Yes, his symptoms are not horrible at this time, but I do think about other compromised students. What about his teachers, his classmates, parents, grandparents, siblings at home? I would have had no clue for days to be able to tell the school that this had happened. I want people to be aware of this and to be cautious. I truly believe after going through this in our own household, it is so much more real. I think that kids and families will be much safer doing school virtually at the start of the school year. Another key point to this horrible virus is that once you test positive, the health department requires you to quarantine for 10 days, and anyone living in the home that tests negative still has to quarantine for 24 days because the person that is positive could actually transfer the virus on the 10th day to the non-positive family members. So actually, the person who is negative starts their 14-day quarantine on the 10th day. For my family, this will be in quarantine at least 24 days. This is a very serious virus, and the scariest part is that not everyone runs a fever at the beginning or at all. Everyone's symptoms are totally different. I'm very worried about my husband, whose symptoms are horrible, and my fear is that my son may get that bad, but I still don't know as we are still going through it. Please take careful consideration before opening the school to the 2-day face-to-face for students. Thank you for making all of these hard decisions and all of the time that everyone is spending on this. We're truly concerned about the long haul and what this looks like for our school system the entire school year, not just at the beginning. And thank you. Thank you for your time, and I'm sorry about the technical difficulties.
Thank you, Ms. Wood. That's it. All right, we will close public comments at this time. Thank you. Board member reports. Let's see. Dr. Shores, what do we have from the governor's school?
Well, I think we're well organized. That's all I can say right now. All of our people, all of our courses are covered. We had several nine in your other areas.
Okay.
But every position is covered, and new director has done what I think is an outstanding job.
Are you all virtual or are you in person?
Virtual.
Virtual. Okay. Mr. Go for it.
I had the opportunity to meet with the new director of the Bridging Communities. And her comment to me was that she felt like for career and technical education, they could not do it virtually. We do have a meeting Thursday. Dr. Gretz is the superintendent in charge, so he and I will be going to see. I don't know how we're going to do it. It's
right now they've got a schedule proposed that has the 6 divisions divided where 2 are coming at different times. So Middlesex students will go to the Bridging on Tuesdays and Thursdays, which just happens to line up very nicely for us, but that's how they're approaching it as of now. I think they're going to bring the board a recommendation, but that's the status at this point.
as far as the Middlesex Foundation, we have a meeting Wednesday The latest word that I got from Bruce DeSimone is that we may be as much as 2 months away from possibly starting construction. So we'll see. As I mentioned before, the thing is that if the water system is going to be in place the time our building is complete, so that's the kicker right now.
Okay. Anything from the task force? Mr. Harry, anything from?
Other than WHRO is our partner in this entire thing,
Mhm.
as well as social protection. But they are amazing what they have got ready to help.
Wonderful.
If you can just see some of the stuff they've done, it's amazing. It's a great relation. And thank you for having available now.
We had a regional special education meeting Wednesday week ago. No, this past Wednesday. And we have a new director who I think is, going to do really well. They have not worked out the Gloucester is all virtual, and so they have, and of course, which is where the regional SPED is housed. They have not worked out the formal details, so we will be meeting again on the 19th so that she can present a plan as to how our regional SPED children will be taught. So in September, I can give you a better look at that. All right, is there a motion to approve the consent agenda?
So moved.
Second, all right. All in favor indicate by saying aye.
All right.
I probably skipped something. No, I didn't. We're good. Action items, the appropriations on page 13.
Thank you, Madam Chair. Board members, we have several appropriations that were processed last week with the Board of Supervisors. If you look on page, of course, there's a summary on page 13, but I'll just go through each one of them very briefly. If you have any questions, stop me and we can address them. Page 14 and 15, both of these are carrying over balance from one fiscal year into this one. The first one, textbook funds unspent to come into this year, and then appropriating carryover food expenses to come into this fiscal year. On page 16, this is appropriating funds through the CARES Act, Coronavirus Relief Act funds. 290,000+ appropriated to us, to schools through the act, and then 200,000 from the county. So the county taking that from their portion and giving that to the schools. And you can see laid out in here how these are being spent. Largely, it's capital outlay to support the purchase of LTE-enabled devices for us to distribute to our students. But there's also some other costs in there. 140,000 to support salaries and wages of the cafeteria, taking us through the summer and into August 24th. So are there any questions that you have for me on that? We're putting together cleaning kits in association with Laser Clean for each school. Each classroom will have a kit that can be used, and Laser Clean is going to train our staff on how to use them. That is money that's coming over from the county as well to support that. So that's that appropriation. If you have any questions, I'm happy to answer those. On page 17 is appropriating a gift that came to us from the Rotary Club. If you remember, they came and presented in your last meeting. $3,300, that's going to support the purchase of hospital-grade thermometers for each school. That was a direct result of our nurses requesting those. And so we're very happy to have that gift from the Rotary Club, and we're appropriating that accordingly. SunTribe, our partner in the solar arrays, has donated $1,000 to us to support the development of a wireless on wheels mobile wireless cart. They cost, I think, a little more than $2,000, so this will support half of that cost for us to create one of these freestanding units that can be put somewhere in the county to support wireless access for those. And then finally on page 19 is the appropriation of the remaining funds from all of our federal fund appropriations from last year to be carried over into this year. So it's simply taking the leftover in each one of those awards from fiscal 20 and appropriating them to be used and spent during fiscal 21.
All right, is there a motion to approve the,
And you have one more that you just added tonight.
okay?
Sorry?
There's one more appropriation that was added tonight.
What?
There is an additional.
Here it is.
I don't have it.
Okay.
Oh, okay. Yeah. So I'm sorry. So this is an agenda item later on in the board meeting. We had a very generous gift from the River County's Community Foundation of $20,000 to support the purchase of school supplies and other classroom supplies. So we were going to recognize that later, but we are going to ask to appropriate that as well. Very generous donation.
Yes, it is.
Move we approve the appropriations.
Second.
Are there any questions about the appropriations? Hearing none, all those in favor indicate by saying aye. Any opposed? All right. We have a revised school calendar to look at.
So board members, we have a couple of revisions that we're asking you to make. Even though when you approve your calendar each year, there is a clause at the bottom that says that the superintendent can do this. I think it's important that we do it together and so that we're all aware, since these changes, some of them are related to the pandemic. The first one I want to call your attention to, and the calendar draft is actually on page 22. We are asking that we bump the start date for students by 1 week. So students were scheduled to start first teaching day on Monday, the 24th of August. We're asking that be moved to Monday, the 31st of August for students only. And the primary reason for that is to support the additional professional development and collaborative work that our teachers need to do in order to be prepared to deliver virtual instruction, to build the remote course content that they're going to need to use. When we made the decision to go pre-Labor Day for this coming school year, one of the ways that we mitigated the fact that summer was going to be shorter, obviously at the time had no idea that we would be in the situation we're in now with the pandemic. We shortened the professional days on the front end of the calendar so that teachers would have a few more days of the summer before coming back. Well, the net impact of that, given the fact that all of our teachers have had to regroup and learn a new learning management system, Canvas, learn how to operate in virtual Virginia and the different tools that we're going to be using to develop the course content, is essentially when we put together the professional learning days at the beginning of the year, realizing that our teachers were only going to have about a half a day devoted to that. Now, some of them have been doing it all summer. Many of them probably have been doing it over the summer. But we felt like it would be prudent for us to give our teachers a solid week of time to be dedicated to developing and building capacity around that. So that's the reason that we're asking to move that first teaching day by 1 week. Staff that were planning to come in on the 24th would still come in on the 24th. Our staff that was going to be involved in providing childcare would still provide that week as they were going to anyway. So that's one change. Another change you'll see is in October. We did not see the need to keep the full day of professional learning and the full day of parent-teacher conferences the way we typically had in October, since teachers are going to have a dedicated day each week on Wednesday to have that professional time. So we felt like those should be repurposed for instruction. And then finally, in November, traditionally there's a holiday associated with the day before the Oyster Festival. With the cancellation of the Oyster Festival, we felt like we could repurpose that holiday for an instructional day. So those are the changes we have in this calendar for you.
And election day, that has to be a holiday, correct?
Right, that's correct.
Did you add days at the end of the year?
I'm sorry? What?
Election day is not a school holiday.
Right, no, I'm sorry. It's not
School holiday,
it's not a student holiday.
and our schools are not used.
I
It
thought
only
the
is when,
governor had said,
A state holiday, but not a school holiday.
yeah, I'm sorry.
I thought they wanted to use school buildings. Okay, thank you.
Did you add days at the end of the year?
No,
So we still have 180, how many teaching days?
if we don't amend the calendar, we will not have the 180. I think what we would like to do is enter the school year, see how things are going, and see how we need to amend our calendar as such.
Okay.
We probably would just need to add the days, the teaching days on the end that we subtracted from. Because we won't be able to shorten the instructional year.
So you need a motion to approve the changes?
Yes.
sir.
I'll move to approve.
Is there a second?
Second,
Are there any questions about the calendar? All those in favor indicate by saying aye.
Aye.
Any opposed? All right, thank you. We have the easement agreement that we need to discuss.
So you'll recall that Middlesex was approved as one of the initial school divisions to pilot the electric bus program through Dominion Energy. That program has been processed through the different protocol in the county. The funding to support it has been appropriated through the CIP at the county level. And so what happened was the agreement that Dominion originally drafted did not satisfy the attorneys that were representing the school divisions that were part of that pilot program. So there was a delegation of representative attorneys, one of whom was Brad King, our attorney, that formed a committee to get together and work collectively with the Dominion attorneys to agree on the agreement. And it did take them quite a bit of time to do that, but they have now acquiesced this agreement. It satisfies everybody legally on both ends of the spectrum. And so I'd like to ask you to approve our entering this agreement and thereby moving forward with the procurement of those buses accordingly. We've met extensively with Brad, Mr. Harrow and myself. Billy Eubank has been involved in that just to make sure that all the specifications related to what we're responsible for and what Dominion is responsible for, we believe are reasonable. And again, it's satisfied all the requirements. And so we would ask for your approval to move forward in the next step of this process, which is procurement.
Of the buses.
Yeah.
Mr. Harrow?
Yeah, I move that the Middlesex County School Board approve the sole source statement presented this evening for the purchase of 2 electric school buses and direct the division superintendent to post the required notice related to the sole source.
Is there a second?
Second.
Are there questions about the,
Have they started the electric work at St. Clair Walker?
The installment of the electric charging station?
Yeah.
No,
I thought I saw them down. Okay.
not that I know
is there a time frame on that?
of. Not one that they've specified. It's not going to take them long. I think they're just waiting on everybody to move forward with the procurement.
Okay. Hearing no other comments, all those in favor indicate by saying aye.
Aye.
Any opposed? All right, thank you. We have a resolution in support of the funding of SROs in schools. At our last meeting, we asked Dr. Gretz to move forward with that, and he has done so. You want to tell us about that, Dr.?
Thank you. Yes, Madam Chair, board members, I've written the letter that went to Delegate Hodges and Senator McDougal on behalf of our school board advocating for opposition to any kind of legislation or financial movement at the state level that would redirect funding for our SRO program or eliminate it. Since we had our meeting and since the board acted accordingly, there was a resolution that was developed by a senator in Southwest Virginia, Todd Pillion, and that was offered to Virginia superintendents to partner. And so we have brought you this resolution that we thought would be a strong supplement to our letter for you to approve. And you've seen it, obviously, and I'm not going to take the time, unless you'd like me to read through it, but essentially it resolves that.
77, page 77.
Page 77 is the resolution. I'll read just the last part for the benefit of those that are listening. Whereas Governor Ralph Northam stated on June 13th, 2019, that it is paramount that we continue to make smart investments to keep Virginia schools safe and to create supportive learning environments for our students. The school resource officers and school security officers hired through these grants not only make our schools safer, but also enhance our communities by building strong, positive relationships with students, faculty, and parents. Now, therefore, be it resolved that the Middlesex County School Board does hereby request that Governor Ralph Northam, in conjunction with the Senate of Virginia and Virginia House of Delegates, maintain the existence of the School Resource Officer Grants Program and fund with adequate funding therein.
Is there a motion to approve the resolution?
So moved.
Is there a second?
Second.
Any comment? All those in favor indicate by saying aye.
Aye.
Any opposed? Thank you, Dr. Gretz.
Thank you, Dr. Gretz, for doing that.
All right. We have policies to approve on second reading. We talked about these on first reading earlier. Dr. Gretz, any changes?
Oh, no changes. The only update is I have confirmed that our schools do have the national motto posted. That was a question that came up in the last meeting, and so that's item B. So just wanted to follow up. That is in the schools.
All right. All those in favor indicate by saying, excuse me, a little jumping ahead here. May I have a motion to approve on second reading these policies? Thank you. Is there a second?
Second.
Are there any questions for Dr. Gretz? All those in favor indicate by saying aye.
Aye.
Any opposed? Thank you. Got it done right. All right, our crisis plan updates.
So board members, as part of the Virginia school safety protocol that have been put into place, really dating back, I believe, to Governor McAuliffe, is when these were last revised. We do annual safety inspections, safety audits. We do an additional audit every 3 years, and we do safety checklists. And each school certifies that they have a plan, and the school board certifies by the end of August of each year annually and reviews the division-wide crisis plan. So that crisis plan has been reviewed by our team and updated accordingly. The only thing I'm going to call your attention to, I know that you've been through the plan already, but we debated on whether we should update the pandemic section of the plan. Most Virginia crisis plans were updated in around 2009 and 10, specifically in that area where all school divisions needed to come up with a separate pandemic response plan. Back then it was in response to the swine flu. If you read through that section of the plan, every element of it is still applicable to our plan to deal with the current pandemic. And since we have a separate health plan that has been reviewed by our risk provider, our attorney, and has since been submitted to the BDOE in compliance, we didn't feel the need to necessarily update the pandemic plan. Nothing contradicts in the two. If it's preferable to the board, we can insert that health plan as part of this one, but we felt like the two of them in tandem together covered all of those needs. And so that's the only thing I'd point out to you. Otherwise, I would just simply recommend that you approve that you reviewed it in fulfilling that requirement of the DCJS.
All right, is there a motion to approve the Division Crisis Management Guide?
So.
Is there a second?
Second.
Are there any questions other to enlighten us any further than what Dr. Francis brought up?
And I assume this is our copy.
I don't see any reason to insert that because,
We didn't either.
I mean, it's a pretty fluid document. You put it in
It is.
here and then.
It is.
Okay.
And each school develops their own crisis plan. The templates are all in here that you approve, and they keep those updated each year as well.
Okay. All those in favor of the current updated management guide indicate by saying aye.
Aye.
Any opposed? All right, thank you. The innovation grant.
So board members, the next item is, the next item is for you to approve our moving forward with a letter of award that we've received recently. This is really great news for our school division, and it is especially kudos to Dr. Seitz and the folks that she has worked with over the past couple of years to cultivate a relationship through our Learning Innovation Network partnership. Did I say that correctly?
Readiness Learning Innovation Network.
Yeah, Innovation Network. I never know where the words go. But they established a partnership with West Point and Pocosin and CERN, William and Mary. And so this is really kind of it's not necessarily related to that, but a lot of the work that was done to be named the Division of Innovation and to be has led to our successfully being awarded $50,000 to pursue planning to essentially take the concepts that are at work at Compass Academy, flexible, and ironically, many of them are the kinds of things that we're having to do now in order to address remote learning. Flexible scheduling, hybrid model, where there's a mix of face-to-face and a mix of virtual learning, student-directed and self-directed learning, and a large component of community-based, work-based learning opportunities. So for us to take those things and to expand them at the high school, to be able to involve more and more kids in those kinds of opportunities. So we were one of only 5 proposals in the entire state to be awarded this, the maximum amount of $50,000. So we're very, very pleased to be able to move forward this year with that. I'll read the last part of the letter from Dr. Mangelbach. And that is, thank you for reimagining the high school experience for students in your division. Your visionary leadership will not only have an impact on students in your division, but holds the potential to affect the lives of all students in Virginia. So we're very, very excited to begin this planning work. Dr. Seitz and I and Mrs. Fleet and Mrs. Norris worked together on the application and on the vision for how the high school and Compass could work together to provide some of these opportunities for teachers at the high school.
Great, it's wonderful. And then the River County's grant that we already spoke about. Anything else on that?
No, I really just wanted to wanted to recognize them for their generous partnership. This was something that came out of a regional conversation, and honestly, it really was initiated by the grant committee, more so than us applying for a grant. They really wanted to do something to help area school divisions, and there was a conversation started regionally. And I think they worked with some of our staff members and some of our board members. So they continue to be a very, very generous and very supportive, impactful group on our schools.
It's wonderful.
Do we formally thank them in any way?
I think other than a letter or something like that, we could certainly invite them to a board meeting to do it a little more formally as we get deeper into the year and maybe can have more in-person opportunities. But I'm certainly open to any ways that the board thinks would be appropriate.
Well, that is appropriate.
Yeah.
He was wondering.
Absolutely.
There was to have been a meeting where we went to their meeting.
Yeah, last April.
Right. And because of COVID, the meeting was canceled. And it was about Compass Academy because they had given us to fund that. And so but that got canceled.
It would be nice if at the end, though, you give them some report of how we spent it.
Yes, we definitely need to do that. We will do that.
Do we have Dr. Williams anyway?
That's what we're checking.
He's checking to make sure he hasn't called me.
Hi, this is Dr. Williams. I've been listening.
We're checking, it doesn't look like it yet.
No, he's
Oh, he's there. Oh,
Okay.
Find it then, okay.
All right, great.
So the next item is the reopening update, and we're fortunate to have with us Dr. Williams from the Three Rivers Health District to give us some information regarding opening and to allow us to ask questions of him. So just trying to get him online.
Is he on there, Steve? He was, yes. I mean, is he ready for me to talk to him? Or are you still waiting for him? Yes. Dr. Williams, do we have you? Can you check your audio with us?
Yes, can you hear me?
Yes, we can.
Fantastic. Thank you so much.
Okay,
So, first of all, Dr. Williams, I've got some information that I'm going to share with our school board related to a survey we just did with our staff and some general information. But since we have you, first of all, let me just thank you for joining us tonight. I know you had an engagement with another school board and you have made yourself available. I have no idea if you're in your car or in somebody's office or a closet somewhere, but I really appreciate you doing this. And this is characteristic of the way you have made yourself available to us and to many others in the region throughout this pandemic. So let me just begin by thanking you for that. You've been very available to us, and I've appreciated that communication.
so I'm sorry, is Dr. Gratz, is it my turn to speak at this point?
Well, I just wanted to make sure you were there.
Yeah, I'm here. I understand that you're gonna say a few things and then you'll turn it over to me, right?
Well, I can do that. I can do my presentation, or in respect to your time, part of my presentation was to share with our school board the new dashboard that's been developed and the implications of that data and how that data impacts the Department of Health's recommendations for Middlesex. And I don't know if you want me to ask you some pointed questions to get started, or if you'd like to just in general present that to everybody first. How would you-
I can actually share my screen and I can take you through the dashboard in real time as it exists today.
That would be great.
Okay, so if I'm allowed, I'm going to click share screen. And then I will expand the dashboard and I will go ahead and talk about it. Is that okay?
That's great.
Okay, so here we go. So can everybody see my screen?
No.
Not yet.
Okay, let me go back to, sorry. There may be, okay, here we go. I need to click a second button. Now can you see my screen?
Yes, sir.
Okay, good. Okay. Okay, there's two people have entered the waiting room. I don't seem to be able to get rid of that on my screen. I apologize. But in real time, this is the VDH pandemic metric dashboard, okay, as it exists today. What you're looking at is the transmission extent color-coded by region across Virginia. There are 5 health regions in Virginia: the northern, central, eastern, near southwest, and far southwest, I guess. Actually, it's northern, north, central, central, eastern, and southwest. For this chart, they've broken up the southwest into far southwest and near southwest. So if you can follow my cursor, at the moment, we're experiencing in the far southwest region substantial transmission. This is color coded from substantial, which is the highest level, through moderate to low, and then no transmission. So currently in the far southwest, we're at substantial transmission increasing. In the eastern region, we are at substantial transmission and we are trending steady. In the central and near southwest, we're at moderate transmission increasing. And in the north, we look the best. In north, central, and northern, we're steady and we are at low transmission. So I'm going to go now straight to locality metrics. Now, for the purpose of the pandemic companion planning document, the mitigation measures are keyed to regional transmission levels. So let me go ahead and go to the locality dashboard. So I've gone ahead and called up Middlesex County here. And what we're displaying here are cases per 100,000. At the regional level, this pandemic document takes into account about 8 or 9 different parameters. There's caseload per 100,000, percent cases amongst healthcare workers, percent positivity of cases, outbreaks, admissions to hospital, admissions to ICU, and PPE availability, and a few other hospital-based metrics. So all of those things churn through mathematical algorithms and result in a transmission level being assigned regionally. At the locality level, we're missing the hospital data. So the Virginia Department of Health does not stipulate transmission levels at the locality. However, I think that the most sensitive indicator of where we are transmission-wise is the burden of cases and whether it's going up or down. And this is per 100,000, and that's what I'm showing you here across the Three Rivers Health District. So if you hover your cursor in this tool over a county, it'll show you what the case per 100,000 load is. So if we go to Middlesex County here, let's see, Middlesex, there we go, Middlesex County, you're currently at 18.57 cases per 100,000, and you've been going up for the last 39 days. If you look at all the counties in the Middle Peninsula and the Northern Neck, 6 of them have transmission levels that exceed the red flag for cases. The case load is flagged to turn red at 10 cases per 100,000. 6 of our counties have more than 10 cases per 100,000. You can see Essex there is at 26.17, which rivals some of the, maybe I can make it go away, rivals some of the jurisdictions down here in Hampton Roads, okay? Gloucester, Matthews, Northumberland, and Richmond counties are at a little bit lower level. And if we go down here, you can see from a case burden quite high at 18.6 for Middlesex. PCR positivity is below 10. It flags at over 10, still higher than the state average at 8.5%. Outbreaks, you have 1 at the moment, but it hasn't caught up with the dashboard. It will in the next day or two. And I think percent healthcare workers, I don't think I can see that at the moment. I'd have to cone in on that. We can see it up here if we choose healthcare worker for Middlesex County, and you've tumbled to red at 0.2381% cases in healthcare workers. So I think if you look regionally and you look specifically at Three Rivers, we're getting worse in the pandemic. The case numbers are increasing. There's a lot of virus out there, just like there's a lot of virus in many places across the United States. I can tell you already in the past couple of weeks, or in the past week, we've had 3 diagnosed cases of COVID-19 in 1 case each in 3 different schools and 2 school systems. So we are already having trouble with faculty coming back to try to prepare for the school year with COVID-19 disease in the schools. With virus levels this high, if any congregate setting with virus levels this high, the risk of disease transmission is correspondingly high. Mainly from asymptomatic cases. It's estimated that 40% of all the cases out there are actually asymptomatic. I think you probably heard a testimony about that earlier today in this meeting. That is very, very difficult to defend against. You're not going to pick that up on temperature screening. You're not going to pick that up on surveys. And those are the folks the kids and adults same that are going to get into the school system and pose a risk for viral spread. From a child perspective, susceptibility perspective, there's been a lot of information and misinformation about that. I can tell you categorically children are not immune to COVID-19. They can contract the disease. They have, in general, very, very much less severe disease than adults do, okay? So the hospitalization rates are very low and the mortality rates are extremely low for this disease in children. But they certainly can get it. And there are some studies emerging that seem to indicate that children may, like they do with other respiratory viruses, they can actually carry more viral load being asymptomatic than many of their older children and adults carry. So children certainly are a risk for transmission, and serious disease can still occur in children. Early experience nationwide, I think last time I looked, there were 6 states listed where schools had opened and then had to close for outbreaks of COVID-19. So this is a very real risk for schools opening. I think if those schools that do open for congregate learning, even in small groups and even with young children, because to defend against this virus in a congregate setting, it can be done, but it takes assiduous attention to detail when it comes to masking and maintaining social distancing and sanitation and hygiene practices and all that. We've proven that in places like poultry plants, you can actually safely work in the congregate environment, but you have to, if any break in PPE, and we've right now got a nursing home that's suffered a very large outbreak because of a break in PPE discipline. And that's, if you have a break in discipline, this virus will exploit it and it will spread very fast. So that's kind of the current state of affairs and the current spread of the virus in our communities. And I will be glad to answer and entertain any questions.
Thank you, Dr. Williams. I've got a couple, but let me defer to board members first who might have questions for Dr. Williams. Anybody?
Dr. Williams, in Middlesex, how many active cases do we have? Because I know the number is there, but we had cases very early in March. So the number that is put on the dashboard that I look at every day, is that accurate for active cases?
Yeah, this, we don't track active versus inactive. This, for the purposes of the VDH database that you can see online, the outcome of this disease is binary. It's recovery or death. Okay, so you can sort of get an idea of how many active cases there are by tracking numbers of new cases week to week in each locality, if you wanted to do that. This dashboard, it reflects a 7-day moving average of the number of the case burden per 100,000. And that means new cases diagnosed. That does not take into account all the historical cases that have already occurred. That's new cases diagnosed and cases per 100,000 incidents on a 7-day moving average. So this map kind of takes the active versus, it reflects pretty much actively spreading and transmitting disease in the localities for which it expresses data.
Okay, good. I understand that.
So, Dr. Williams, can you hear me okay?
I certainly can, sir.
All right. Again, I really appreciate all the communication you and I have been able to have over the last week or so and before. Some of these questions are questions for the benefit of all of us who are making this decision together, and some of them are new questions I have. So I guess the first thing I would ask, could you just briefly explain, I had planned on sharing this later in my presentation, but could you explain the companion document that has been given to schools that is associated with the data that you're presenting now?
Yeah, as a matter of fact, I've just activated it on my screen. I can enlarge the font so it's a little easier to read. But this is the companion document, BDH guidance for reinstating community mitigation measures in K through 12 school settings. And it's pretty much, it's not meant to be prescriptive, but in effect, it pretty much is. It definitively ties transmission levels to phase reopening guidance, okay? So, and you can see it starts with no community transmission, and then it goes through low community transmission, and then to moderate community transmission, and then on to substantial. And it is by definition tied to transmission at a regional level, because the dashboard doesn't drill down to actually tell you what transmission is according to the calculations that it can produce. It doesn't tell you what transmission is at the local level. So I would say by the region and reinforced by what's happening locally in Middlesex, your community is experiencing substantial transmission. So you would default to this guidance for schools. You would consider phase 2 and phase 1 guidance for Virginia schools. And, specifically, make every effort to protect vulnerable students and staff. And there is strong evidence that has emerged that children who have comorbid conditions are at higher risk for serious illness and bad outcomes than those who don't have. So students, even young kids with comorbid conditions, should be considered high risk. And then this next sentence here, remote learning should be considered as the primary method of instruction, as described in phase 1 guidance for Virginia schools. This is guidance. It's not meant to be or intended to be absolutely prescriptive, but it's pretty definite with what the Virginia Department of Health is declaring needs to be done in each of these pandemic phases. And of course, in this situation, mandatory, require cloth face coverings, and this physical distancing of 6 feet becomes, strict adherence to that becomes necessary. And again, that's because we have experience in other settings where if you break these disciplines in a congregate setting with this much community transmission, you really are asking for.
Thank you. While you have that on the screen, and I'm just going to ask you some very pointed questions, and I trust you to say, hey, that's not my wheelhouse. But the bullet that talks about face coverings, the language that I've seen in really all of the guidance, this included, and I can't see it on the screen right now, but you can read it to us. It says face coverings as developmentally appropriate.
Yeah, and I'm sorry, go ahead.
But the question is, and this is not at all meant to be argumentative, but as we take this guidance and create it, filter it down to be an actionable decision, what I'm hearing tonight from you, and this is echoed by other health professionals that I've been talking to, is that the protection is basically a 100% guaranteed fidelity to maintaining the face coverings and the physical distancing. And your words tonight, you said any breakdown in that discipline, and the pathogen will find those breakdowns and will spread quickly. Doesn't that bullet just inherently in it contain a breakdown when it says as developmentally appropriate? If there's anybody that it is not developmentally appropriate for, they will not be wearing a face covering. Is it as simple as you're advising that in that case, we can expect the virus to spread?
Yeah, I did not author the document, of course. I had no input to it, but I read that as developmentally feasible statement as sort of a nod to how very difficult it is to really adhere to universal masking in children, especially children with developmental problems and challenges. And when you're dealing with substantial community spread, that really reflects only the cases we can see that are seeking care and getting testing. It really doesn't so much reflect all the other cases that are out there and doing asymptomatic spread. And that's kind of really what's going to get you. And, when you look at there's in Three Rivers Health District right now, there's a long-term care facility. Those people are trained. They have good personal protective ability. They know about this virus. They know how to protect against this virus. And at higher levels of community spread, they have a no visitor policy as well, but the staff brings it in, okay? And all this thing takes is a little bit of break in discipline. If it's out there in high numbers and it's asymptomatic people are coming into the congregate setting, all it takes is a little bit of break in discipline, and it will take advantage of that, and it will spread briskly. So yeah, congregate settings with this level of community spread, I would expect cases to arise like they already are in just with faculty coming back. And I would expect a lot of work having to be done with regard to isolating individual cases, doing contact tracing, and maybe even shutting down classes and maybe even shutting down the entire school for a viral incubation period to kind of reset the clock with regard to who's coming back. Those scenarios are very likely given the current level of community transmission.
Okay, thank you. Another question related to the guidance document. So with Middlesex being officially considered substantial burden of community spread by the Department of Health, the associated guidance says that we should consider phase 2 or phase 1. And the way we have interpreted that is not necessarily, as you said, it's not prescribed that we have to go to phase 2 or 1, but we should probably be able to articulate why, after we considered them, we did not do them, or we did do them. So my question for you, from a medical opinion and or a scientific background, what support is there for us, given our data, to, let's say, I think you've already answered the question about why, if we were to ignore this and stick with phase 3. So let me say in phase 2, we're allowed to bring younger children in and students with special needs and English language learners. Is there a scientific and or medical support structure for doing that or not doing that?
Yeah, I think the guidance document was, again, I've discussed this with the highest levels of epidemiology management and population health management in the VDH. And again, the document is not meant to be hard prescriptive and set hard requirements. I think they attempted to write this to give localities some latitude in what they want to do. I think the key thing that you need to do and that the school board needs to do is understand the risks. Understand the risks on both sides of the equation. On the one hand, you've got the viral risks, which at times of substantial transmission and high communities viral spread, those risks are very high. It is likely that you'll end up with outbreaks and cases in the school because it'll find its way in. On the other side are all the risks of education, food safety, and safety period, and those are existential risks for some children. So it almost boils down to, well, it does boil down to understanding the risks, being prepared to accept the consequences of the decisions you make, partnering with the health department to mitigate the risks as much as you can. Obviously, the highest mitigation against the viral risk is a virtual learning environment for everybody. But that may not be possible. It may not even be desirable for subsets of children who may have existential risks by having to stay out of the school environment. But if you do elect to do congregate setting learning, then understand that it is very likely that under current transmission circumstances, very likely the virus will find its way into the school, very likely we'll have cases, very likely we'll have outbreaks. And it becomes that much more imperative for the health department to be very close to you, to keep you informed of what the virus is doing, and to be ready to react quickly to try to stop the spread and stop outbreaks if those cases occur. I don't know if that kind of answers your question or addresses your question, but that's pretty much at least how I interpret all this.
Yeah, thank you. No, it does. I guess the last one I'll ask is, could you just briefly, you shared with me over the weekend some examples of what's happened in other states. Are there some examples that we can learn from that you know of that you feel comfortable talking about tonight?
I'm sorry, sir, I didn't hear the last part of yours.
I said, are there examples of other states, other schools that have opened and their experience with this using similar plans to the one we have been proposing that you feel comfortable talking about tonight?
Yeah, I just know what's been reported in the press nationwide. There haven't been any CDC weekly publications or anything like that specifically addressing the experience in schools. Right now, we know in countries where, like Denmark, for instance, where community transmission is extremely low, and in places like Taiwan, where community transmission is extremely low, a tiny fraction of what it is in Middlesex County, that those places have been able to open schools with a degree of safety. In the United States, so far, the early openings of schools in Georgia and 4 or 5 other states that I can't remember at the moment, plus Texas. Texas had to shut down because of COVID in an athletic situation. But so far of the states that have opened early, at least 6 of them have had the necessity to go ahead and shut down their school systems for a period of time. And then there's that Georgia camp experience with the campers where there was really high spread among school-age children that basically shut the camp down less than about 7 days into its operations. And ultimately 260 of those kids tested positive for COVID. That was reported by the CDC 2 weeks ago. So, but the evidence is not great on these things. It's early experience and international experience only. So to a certain extent, we're all serving as, experimental subjects and controls in this, without controls actually, in this big human laboratory we're living in. So I can tell you what has happened elsewhere, the limited I know. I can tell you what industrial experience is. I can tell you the characteristics of this virus and its ability to transmit rapidly. And I can tell you what I think you can expect. But at the end of the day, I guess it's a matter of risk, understanding risks and accepting risks.
Board members, any questions for Dr. Williams?
Thank you, sir.
We really appreciate you being with us tonight. Thank you.
Thank you,
Yes,
Dr.
sir. My pleasure. I will sign off if that's okay.
Fantastic. Thank you.
Let me confirm that I have stopped sharing my screen.
Yeah.
Okay, good. Thank you all very much. God bless you. And whatever you decide to do, you'll find the health department in firm support. We'll be with you every step of the way. Thank you. Bye-bye.
Dr. Prince,
Yes, sir.
you and I have had the conversation that we were being included with Hampton Roads. Is why we felt like that we could not go beyond phase 2. But he more or less said Middlesex. He didn't include us necessarily with Hampton Roads as the reason.
Well, I think you're right. Anecdotally, he did talk about our community being substantial.
Right.
The dashboard still does include us in the eastern region.
Okay.
But he did go through that. Steve, am I able to pull up those slides now?
Well, because of the way this entire area moves back and forth, Hampton, Richmond, we're all over the place. We have people working all over the place. So I can somewhat understand why they consider it a regional situation. I don't see how they can do it any other way. There's so much intermingling of all those areas.
Yeah.
Workforce, children, so then, I wanted to ask him that question, but after, as I think about it, I do understand.
Yeah.
I don't really like it, I understand.
Yeah. Yeah. Well, I've got a little bit of information to share with you as we continue to think about this. You can go ahead, Steve. So my plan was to share some survey results with you, to to go over the dashboard, which we just did in the document, and Richard Williams. So really, I just have the first bullet, and we can just go right through them, Steve. We surveyed our staff last week for the second time. It was not the same survey. The first survey was in June, and it was really more designed to get feedback from our teachers about how remote learning went, how confident they were to do it in the future, what kind of training that we needed to do. And it did give them some open-ended questions. What do you wish we had known when we shut down the schools? What kind of advice would you give the administration? Things like that. As the situation has developed and people's dispositions have evolved, we wanted to very quickly try to ascertain where our staff was. And so I'm going to pull out just a few of the data points. You can see in this one, I point this out just to simply say, very few of our staff have indicated that there is some sort of a medical condition or any kind of condition that would require them to miss work, either due to the virus, to the need for FMLA, or any kind of ADA accommodations. I need to work from home. I need teleworking. Very few out of 154, I think, responses when I finally downloaded this over the weekend. So that's just a data point. We don't have a whole lot of teachers or staff who are indicating I'm not going to be able to come to work for in-person learning. This was just interesting. I actually, in my mind, I wasn't sure when Dr. Williams was going to join us. This is just one of those word art documents that shows the repetition of certain words in all of the comments that were made by teachers. We got some extremely thoughtful comments, and Dr. Seitz and I have read through every single one of them. But I won't go over that. That was really more artistic to be in the background while I was introducing this. So this survey, you can't see what's at the bottom, but essentially what this does, Steve, what's it going to do to our viewers if I walk? Oh, okay, there you go. So we asked staff to rank the factors that influenced their comfort level with coming back to work. And so you can see which ones seem to be more of a factor in whether or not a teacher or staff member are comfortable. I did think it was interesting that repeatedly, what I'm hearing from all of the health professionals, from school, local, district, on up to the Virginia Department of Health, is an insistence upon adherence to the masks and the physical distancing. And those were definitely the number one factors that teachers cited. If you see face coverings for staff and face coverings for students, essentially teachers saying, my comfort level with coming back to work is directly related to whether or not adults and kids are going to be wearing face coverings. So if there are any data points there we want to go in more deeply, I just wanted to point that out. That sanitation, hand washing, I think a comfort level with, well, notice on the right, the second highest, or at least in that grouping, is teachers' comfort level, staff members' comfort level is directly proportional to the extent that they believe we are following the recommendations of the Department of Health. And you just heard some of those recommendations.
Yes.
Okay. This was more of a general question related to what kinds of things impact your ability to return to work. Overwhelming majority said there's really nothing. A few people said concerns about personal health could affect my ability to return to work, and concerns about my family's health. Certainly documented medical condition and childcare, but overwhelmingly, most people said there really is nothing. I'm ready to come back, and I can come back. Although the commentary revealed that even those that are eager to come back and are willing to come back do have, many of them, concerns that they approach the work with. They're apprehensive for several reasons. So that's really the dashboard. You've already seen the dashboard. So I guess what I'll do is just make a couple of comments. I've thought really about not much else than this for the past several days. The information that you've just seen, the dashboard is new. It was developed in late July. It was piloted. I say piloted. It was released in draft form to superintendents, but it was an internal document. It was just publicly released, although it's still a VDH internal document. It was just officially released to be used last week. So the guidance, the dashboard and the associated guidance from the VDH that advises if you're moderate, you need to look at phase 2. If you're substantial, which that was the first I had seen that. Yesterday, that was not what that said. So we've just seen that we're substantial. The guidance from the Department of Health is to consider either phase 1 or phase 2. The plan that we have proposed and the plan that this board approved has assumed phase 3 because all of Virginia is in phase 3. So this is brand new information. As I have consulted, I'll just simply throw out some pieces of information for you. These are just general statements. All of the guidance documents that we have received from the Department of Health, from the CDC, and from our own Department of Education, the big 3 R's book, the Redesign, Recover, Restart book, all of that points to school divisions to work with their local health departments on these decisions. And as I think about the local health department, its relationship to our school level health professionals, our greater district level health professionals who we just heard from, the overwhelming sentiment that is being offered to me as that advice that all those guidance documents point me to is that unless we can ensure 100% fidelity with wearing face masks and social distancing, that we should not be bringing kids into a congregate setting at school. So that's one piece of information that I have. With our health plan and with our reopening plan, so both are required. The health plan that we have submitted to the DOE needed to be approved by our risk management firm, Vacor Liability, our legal team, so the school board's attorney reviewed it, and then ultimately had to be referred to, and it was reviewed by the health department as well. And all of them approved the health plan, understanding that all 3 approvals came before this new information of the dashboard and the associated guidance with the VDH. And what I will say is that the caveat, if that's the right word, the qualifying information that was given by our legal providers as well as our risk management team was, as long as you are following the recommendations of the local health department. And so I'm just simply saying that for me, superintendent who has no experience in public health and no experience in medicine, I believe it's my responsibility to not only take these considerations, but to even give them an inordinate amount of prominence in my decision-making. I don't have a personal expertise or experience to bring to the table by which to second guess the experience of the health professionals that all of the guidance documents are pointing me to. And with that being the case, I guess I feel the need to say, as Pete Gretz, the dad and the husband, I have a personal view of all of this. It's not informed by any expertise in medicine or public health. And my personal view, along with my wife's personal view, it governs the decisions we make for our family and for our kids and the way we conduct our business. But I have done a lot of reflection over the past few days to make sure that I'm very clear and that I'm comfortable with the extent to which I take my personal views about these issues on behalf of my kids. And I need to be very careful, I think, not to write those by way of my recommendation to this board into school board policy and protocol. And I think that it is more appropriate, certainly I don't set those personal views aside, but I think the appropriate response for me as a superintendent is to take the recommendations of the experts and the professionals and to take the guidance documents and to use those collectively and collaboratively with our team to inform the recommendation I bring to you. And accordingly, I don't see how, when every single medical and health professional that has been designated in the protocol to advise me, I've shared my kid's pediatrician in Richmond thinks we need to come back to school. None of these guidance documents tell me to work with my kid's pediatrician. Every single health and medical provider and professional who's been designated for me to consult with has said, unless we can ensure 100% fidelity in the discipline of masking and physical distancing, we should not bring kids into a congregate setting. The VDH guidance in writing says that we need to back off to phase 2 or phase 1. And accordingly, I don't know how I could, in good conscience, recommend to this board that we continue with our reopening plan that calls for hybrid learning for everybody. And before I say more, I'd really like to open up for any discussion that you all have to offer about your opinions of whether or not to even consider phase 2, which allows for the younger children to come for in-person learning and special ed. You heard what Dr. Williams said about that. And so I want to pause, and I appreciate you indulging me, giving you some of mine. That's just the way I process and reflect these things. I'm extremely conflicted about this. As I've shared with you and others, personally, I believe that our work as educators is every bit as essential for students' well-being and the community's well-being as the role of those that are opening the grocery stores and the role of those that are showing up every day in our medical facilities. The devastation that is happening with children for whom school is the only learning intervention is unfathomable. And I personally, it weighs on my conscience that we are not able to address that. That said, I do recognize that I don't feel like as superintendent, I have the luxury of remaining conflicted. I have to bring you a recommendation. I have to come down on one side of the fence or the other. And with all of the advice that I'm getting from our health professionals and the experts and the recommendations, I don't believe that I cannot recommend that we move forward with hybrid learning for all.
Is there a motion that we could put on the floor so that we could discuss that motion?
Yeah, I'll put one on. I would motion that we look at least a 9-week period on starting school and then revisit this situation and see if we can do anything different at that time. But my motion is that we do virtual learning till the first 9 weeks and then revisit.
Is there a second?
I'll second it for discussion purposes.
All right, the motion is made and seconded.
All right, so what I think he's saying in the motion is that we do not include kindergarten special education in school setting. Is that right?
Yes.
Okay. I'm don't know how we would even start them in virtual, though, is my problem. So they're going to get no, some of them are going to get no instruction. We don't have a special ed individual here. What about those special ed students in their IEPs that require speech or hearing impaired, or those special services? How do we meet that obligation?
If I could offer a couple of words, I think my recommendation would be, I'm just pulling up the guidance. Probably in the motion to include the language that the VDH includes. And the reason I'm saying that is we have some mandatory, so new instruction is mandated. We have to do it. For those students with IEPs, the IEP governs the services, not the student schedule, not the board action. So I think we need to reserve the flexibility. So the language in here says to prioritize in-person instruction for the most vulnerable students. There's some assessments that federally have not been lifted as far as the mandates that have to be done in person. The school is going to have to be able to bring certain groups of, is it pre-K through 3 or 2 for PALS?
It's pre-K through 3, plus all of our vision and hearing screenings, which will be mandated, and that's elementary and middle sort of grades.
In the kindergarten readiness, is that what?
EKRP.
EKRP?
Yes.
So all those assessments, we're still mandated to do those, and they have to be done in person. We've got to figure that out, no matter what we decide to do holistically with our schedule. So I guess my suggestion is, if the motion is for us to do a fully virtual start for a period of time, we would say we would start remotely.
Adhering to the specified guidelines for.
To provide necessary services to vulnerable populations is what the recommendation says.
Mm-hmm.
Ms. Bellis is on the Zoom call, and if you would like her to speak, she'd be available if necessary.
No, I think that's definitely necessary.
Who's going to speak?
Ms. Velez.
Our Director of Special Education.
I agree, though. We need to try something before we say we're going to go back to the original plan.
Good evening. Can you all hear me?
Yes, yes.
So as far as our students with disabilities, the services that are required are based on their IEPs, and those who can receive services virtually would receive those services virtually. So the speech services could be done in a virtual way. The specialized instruction can be done in a virtual way. It would be our students who have more significant disabling conditions that we would really have to, as an IEP team, determine whether or not it would be in the children's best interest and, given all safety precautions, appropriate to be in a building. There's a lot of things we would have to take into consideration, but when looking at individualized education plans, it has to be done on an individual basis.
Okay, thank you. Anybody else have questions for Ms. Velez while she's on?
No, appreciate it. Thank you.
Thank you, Kathleen.
I appreciate everybody taking into consideration the needs of our kids. I just think it's important that I say that. I think that the amount of time that has gone into planning really needs to be taken into consideration. And I appreciate our superintendent and assistant superintendent and the administrators across the board, and the amount of time that the school board has taken to hear each person's individual desires for our students. So thank each one of you.
Thank you. That's, we feel the same way about you. So we also have Daniel, who is available to just briefly address and answer any question you have about maybe the primary grade students as you consider the motion that's on the floor.
Ms. Daniel, do you have any comments that might help us in our decision?
So I would just share, I know Dr. Gretz had shared with you all in regards to the testing. So of course, at the elementary level, regardless of what format we look at, we need to consider that PALS is a mandate for our pre-K through second graders. It's also mandated for our third graders who are transitioning from out of state for us, or any third graders who received intervention services over the summer. BKRP is also our Virginia Kindergarten Readiness program, and that's an assessment that is given in the spring and the fall that's mandated for all of our kindergarten students. As you all know, we did thankfully have the addition of a pre-K classroom this year. So we added another VPI classroom that was funded. And so we're currently behind the scenes, we've been meeting as a team to look at what do those early services look like for our students in the VPI program, as well as the early childhood special education program, because that's a concern across the state of Virginia right now. How do you meet those needs, and how do you deliver early intervention services, not only in the general ed setting, but as well as those students with disabilities, and of course speech falling under that category. And typically we find the majority of our students receiving those speech services are in those early intervention programs. So that's something I think for the board to consider. I think too, if the board were to consider a phase 2 model, I think something to look at is whether or not a hybrid model potentially would be appropriate for even a pre-K, possibly through 3 grade levels, what's identified by the Department of Education in phase 2. So some school divisions I know are considering a phase 2 model where all students in pre-K through 3 come back on a regular schedule. And of course, the hybrid model is always an option as well at the elementary level for phase 2.
Thank you.
Are you, I know you're familiar with the health plan that was developed. Do you feel comfortable with, if kids come back in the building, that will possibly keep students safe and teachers? I'm putting you on the spot.
Yeah, that's okay. So my world, of course, is the little people all day. And it actually was interesting to me, and I've shared this with the admin team. It was interesting to me when the Department of Education came out with the phase 2 recommendations for pre-K to 3 to attend in person. Of course, we understand those are where the early interventions are taking place. You're building the foundation for reading. We know there's so much research linked to reading and what it looks like for students who are not on target by 1st to 3rd grade. And so it was interesting to me that that was the target population only because of the health linked to it. When you consider 3-year-olds through 7-year-olds and even some older, the idea of keeping them 6 feet apart is challenging. The idea of mandating masks on them throughout the day is a challenge. I think children at that age have a hard time grasping something that they can't physically see. You can tell a child to look both ways before crossing the road, and they can actually see that cars are coming and why they would need to do that, but you still have to remind them of that. And so I think for something that's so abstract for them, it is a challenge, and is going to be a challenge to reinforce and make it come to life for them of why that's so critical for that to take place. At the same extent to that, I will share that we have done some screenings for pre-K within our building where we've had families come in by appointment and they've come in individually. And I was extremely impressed by how well our little ones did coming in for the screenings, because it's become second nature to them. One of the benefits when I think of our health plan that I share with our team of having our children in the school is the health mitigation strategies that we've identified are actually built into almost curriculum that's not truly identified yet. So throughout the day, there's different practices that would be reinforced with our children that then they would apply in a setting outside of school. So they actually have that chance to have those mitigation strategies modeled, practiced, and reinforced during the day. And the hope would be that those would transfer out into the community setting and become second nature to them. So I guess to answer your question, I have concerns about keeping little ones 6 feet apart, about keeping their mask on and then being able to interact safely. And at the same token, I also see a lot of benefits of being able to model those mitigation strategies for them in the school setting.
Thank you.
Ms. Daniel, couldn't those mitigation strategies also be taught virtually?
Virtual, absolutely. They can, yeah. So essentially, you know, some of the conversation we've had is when you look at identifying some of the mitigation strategies, of course, our strategies look at trying to utilize individual resources, but also knowing there's times that kids will still have to share things. There's still resources you have to share. And I've shared with some of our staff, when you go out into a grocery store and you pick up a box and you purchase that right now, several other people have already picked up that box or touched that can before you did. And so for our children in the school setting, we would be teaching them about, you have to share, you have to utilize something someone has previously touched, but we're practicing hand washing skills before and prior immediately, and that it becomes second nature. So it's something you can teach virtually, but it's not actually something you're going through the physical motion virtually, which is a difference.
Any other questions? Thank you, Ms. Daniel.
Thank you.
You're very welcome.
So I guess I would throw out for consideration. That was for dramatic effect.
Excellent. Well timed, well timed.
If maybe the board would consider, if we're proposing a virtual start, that we would, rather than wait for 9 weeks, maybe we check in at 4.
I think that's perfect.
Always having the ability at that point to do another 4 or whatever. Just to be able to work with the Department of Health to see what happens with the dashboard and the guidance, and to be able to also work closely with the providers of the primary grade kids to see what would be the most advantageous. I just throw that out for consideration.
I almost think with early grade levels, you're almost going to have to look at each individual child and which ones would benefit from virtual versus personal contact, whether they have a disability or not.
So
How did the summer school go for you?
Well,
Yeah.
yeah.
That was middle school as well as elementary.
Middle and elementary, so.
if we're looking at a week number that we're trying to select, the next board meeting is the 14th, which means they would really only need until 2 weeks. If we went to the October meeting, we're now talking about 8 to 9 weeks. Would the board like to set up an interim meeting for, say, the 28th of September to evaluate the progress? That would be a complete. No,
Is that progress going to be with the health? Is that right?
take that back. That's going to be one,
I think
two.
that's one data
That's
point.
going to be 3 weeks.
So you didn't?
That would be 3 weeks.
They would have been at 4,
4.
on 28. 4 weeks of virtual, 28, yes, because it start.
You're right, 4. Okay.
You're correct.
So,
Well, so let's think with this, let's say that possibly if there is a favorable result, I guess it's the right word I'm looking for, after 4 weeks, we reconvene and consider this again. However, if it's an impossible result, we don't see any need for us to meet now. I don't mind meeting, I don't mean that. But if it's an impossible scenario, then I don't think that for a worse scenario or not improved, then at that 4 week period, I don't know that we'd be coming in. But it's the same kind of thing we're looking at now. So we should kind of leave it open. That's acceptable with everybody. To leave it open and say if it's a favorable result, at that point, we consider this again.
Okay, this motion is going to be way too complicated, so we need to narrow this thing down, right? Would you like to rescind this current motion so we can make one that will more effectively say what we need?
Okay, I'll do that.
Will you take back your second?
Sure.
Okay, so let's word this appropriately. The motion would be that Middlesex County opens in a phase 1 plan
Yes.
with adherence to.
Well, phase 1 does that. If that's the language you use instead of fully virtual.
Okay.
If you say under phase 1 guidelines, that provides the flexibility for those
Okay.
most vulnerable kids.
All right.
So the question would be, does the board want to amend the 9 weeks to 4 or 6 or whatever it is?
So now we want to decide, let's see, the 12th of October would be the second board meeting. That would be, how many weeks? That's 4, 5, 6. That's 6 weeks, Tracy? Mm-hmm. So at the October board meeting,
6 weeks.
that would be 6 weeks.
Okay.
All right? Okay.
And I mean, we'll be looking at this thing continuously. If this will be a daily thing, and it'll really put itself out there, well, we'll be able to do anything after 6 weeks or not, because it's changing daily.
Right.
And we'll see it as it progresses.
Yeah.
All right, Ms. Jordan, have you got that?
Can I clarify the motion, please? So the motion is that Middlesex County Public Schools open under phase 1 guidelines for the first 6 weeks.
Can we preempt that by saying just as a record, because of health department recommendations? Is that really what we're going on? The board just motions that I'd like to get that restatement in there. Just for our record.
Okay. All right.
I'm checking on something. Can I add just that in communication with Ms. Daniel, there's a window that is for PALS and the PRP that they have to be tested.
Mm-hmm.
And so I'll have to ask you, Dr. Gratz, if that phase 1 allows the flexibility to bring students in intermittently or by appointment to be tested. If it doesn't, we would have asked her when that window ends, but I think it ends before the end of the first 9 weeks. So there are a number of students that will have to come in to be tested during that time also. Just want to make that.
But I thought phase 1 allowed for that.
It should. Let me just double
I
check.
just want to make sure not every,
Right.
but every division in the state's going to be in that same situation, so.
That's what I was talking about. Situation.
Sorry.
All right. Good.
Yep. Yeah, so phase one guidance, I won't read it all to you, but there is a bullet that says, with the approval of the local division superintendent, private school leader, accommodations may be offered for students to access the school building for critical instructional needs, such as accessing a secure assessment or if health, safety, physical distancing measure adhered to.
Okay. All right, so that works.
Yes.
All right, is there a second to that motion?
So do we want to add the language about,
It's exactly what everybody else, I just think it's good for animal reference.
All right, will you read it?
I was just about to do that. Please read it.
see if this suffices, in consideration of current VDH information, MCPS will open under phase one guidelines for the first 6 weeks.
Second that motion.
All right, any further discussion? I'd like a roll call vote, please. And
Question.
sure.
Did you say will open?
Yes.
Wouldn't the word potentially open be more appropriate?
Say it again?
In consideration of current VDH information, MCPS will open under phase one guidelines for the first 6 weeks.
Okay, yeah.
Okay.
So specific to phase one.
Yeah.
Okay, I understood, I kind of misunderstood.
All right, I'd like a roll call vote, and at that moment, if you will, I have written something that I'm going to personally, if any of you want to make a comment about the vote or the circumstances, please feel free to do so.
As we vote,
Yes, as you vote, if you'd like to say anything.
Mr. Hara,
Yes.
Mr. Reed,
Yes.
Mr. Goforth,
yes, and I think it absolutely necessary that we communicate to the public and to the parents as soon as possible. And you tried to do a better, an excellent job on the opening before, but now it's mandatory that we redo it. Thank you.
Dr. Shore,
Yes.
any comments? Mrs. Sojak.
Yes, and I would like to make a comment. In my 9.5 years on this board, as well as in my 29 years as an educator, this is the most difficult decision I have ever been involved in making. No previous issue has required me to make a decision that would seriously impact the health of my community. I believe that having students in school face-to-face with their teachers and their peers is the best environment to positively move students forward in their education. I appreciate the many emails and phone calls I have received encouraging the board to one perspective or another. All are valid and all present challenges. The preparation that has been made this spring and summer by our staff to ensure a positive opening is extraordinary. I'm heartened by our staffs who are willing to step back into the classroom or in our buses and in our cafeterias to meet the new challenges with out-of-the-box creativity and the care for our students. Unfortunately, this is not the time to bring our students back in light of the information and the advice of our health officials. Remote learning has its challenges and consequences, but it is now time to come together, to put down our differences and make the best out of this health crisis. Each of us will need to lend helping hands in order to bring our students and families to positive solutions to this year's challenges. Use our websites and social medias to help one another. Homework may not be so easy for some of us. Reach out just as you do on Middlesex Gifts and Wants. I see this as an opportunity for our community to come together in ways we never have done before. Keep the positive attitudes. Reach out to others. Never feel that you are the only one with an issue. There will always be others. Be the answer to our challenges. Be part of the solutions. The motion is passed unanimously.
Well said.
Thank you. The floor is open for public comment. Is there anyone waiting? Mr. Dunkel?
Will the start date stay the same?
There's a question if the start date would remain the same.
We passed tonight, the start date will be the 31st.
Thank you.
All right, the floor is now closed for public comments. Anything else, Dr. Gretz?
Well, it's been a lot of information. So let me just say we welcome new teachers back today. Dr. Seitz and her team have put together another dynamic program. Even in the middle of all this, there was a lot of energy today. We'll be introducing the larger leadership team tomorrow morning to everybody, and I'd welcome board members if you want to come by and speak to folks and talk to them. We have a group from all over the place, so really good group of new teachers. And I guess I would just say we're very fortunate to have staff who really want to be back in the classroom with kids. We're all conflicted about where we are right now, but the one thing we do not have that I do see in some other localities, we don't know how to say this, but we have people who want to roll up their sleeves and who want to get back to work. And it's very difficult to have to tell them they can't do it. Yes, children too, and families. So what I'll say is we'll shift our attention. I appreciate the board's careful consideration. It's a difficult decision. But we're going to shift our attention from the debate about these other issues to focusing our attention on how to be the best we can be with remote learning and connecting with kids that way. And so we want the start of school to be positive, certainly. And that's what we're going to do.
And while I'm thinking about it, I would like to commend the administration, high school administration, for an excellent graduation.
Thank you.
I was able to attend. It was well done, well put together. And those who volunteered their time for that day, because it was an all-day event, well done. Well done.
Thank you.
Yeah, and we've got to give the credit to Mrs. Fleet and her team. They did an exceptional job putting that event together. So thank you.
Is there any old business to come before the group?
Did you want to announce about the cafeteria?
Oh, I knew there was something I was forgetting. So great news for us. I'll spare you all the details unless you want me to go into the weeds, but essentially our new cafeteria coordinator, school nutrition coordinator, Crystal Jett, has worked very progressively and collaboratively with the Community Eligibility Program, as well as the Virginia Department of Education School Nutrition Department, to enable us this year to offer free breakfast and lunch to all Middlesex students, no matter what grade they're in, no eligibility, no application, free meals for everybody. And we believe this is going to be a favorable thing for us, not only as a benefit to families, but also through the revenue reimbursements. If we can keep our participation at the same level, or hopefully maybe even increase it, we think we might even be able to increase revenue as a result for the cafeteria, which would be a great added benefit.
Yeah.
We are going to continue to distribute meals and serve meals even during remote for everybody. So thank you for the reminder. I knew there was something.
I'll show you something after the meeting.
Any new business? Hearing none, is there a motion for adjournment?
So moved.
I assume those are seconds in there. All in favor indicate by saying aye. Thank you. Thank you, everyone. Steve, thank you.
Central office too.
Extraordinary tonight. You just, thank you.
Peter, I